you need what is called either surge staffing or emergency staffing. These are the people that will come from the different parts of the ministry to help fill those function technical areas within the response. And the planning section, in your planning stage, you identify what staffing is needed. The logistics section then will also look at what resources are needed to bring these people on. The finance and administrative section takes an active role in processing and out processing any type of staff in your public health EOC. They track personnel and equipment time, and they contribute to the incident action plan. The finance and administration section chief will attend all the incident action plan meetings. They will also contribute to the overall strategic objectives of the response. And they will help coordinate and implement the objectives of this section. And the objectives from this section should feed into the overall strategic objective. So now we'll look at the different units that can be part of your finance and administrative section. And the first one we're going to start with is the section chief itself. The finance and administrative section chief, they do not have to be always, as stated earlier, always in the EOC, but they should be routinely available, routinely present and available. They should attend all the meetings, all the leadership meetings, the incident management leadership meetings, the situational awareness. They should be briefing the incident manager on any cost-saving recommendations, any issues, critical issues that may come up. They also need to be coordinating space as needed. Again, you don't need everybody from the finance and administrative section inside the public health EOC. And it depends on, you don't need all of them there, but you do need one or two people to be present. And this is where the section chief will work with the IMS leadership section, the EOC manager, to coordinate these things. Now we'll look at, just do a brief of the compensation unit. And a compensation unit handles the overall management and direction of the matters related to compensation and injury claims within the EOC. During this COVID response, a lot of you are responders, been out there. Some of you might have even been exposed to COVID yourself. So this is where this type of unit will look at maintaining files on injuries and illnesses associated with response and ensure that all witness statements are obtained in writing. During response operations, sometimes property get damaged. And if property damage, the property owner looks to the government to reimburse them. This particular unit here will investigate the property claims and make recommendations to what type of reimbursement, make recommendations to the government and to the incident structure on what type of compensation could be awarded. These are all processes and procedures that's put in place before a response actually happens. Some responsibilities of this unit. includes to implement established compensation processes, implement the established claims process for property damage within the country, provide for technical guidance regarding all aspects of injury, illnesses, and property damage claims, and to investigate and maintain records for claims and compensation. Records are needed, of course, as we all know. And so this particular unit will also coordinate with other aspects within a response. It's important that they coordinate with the medical unit for incident reporting. And the medical unit is identified within the incident action plan. They will coordinate with the safety officer. If somebody from the response, working a response, gets sick or ill, the safety officer can verify whether or not that individual was wearing the appropriate level of PPE, and were they trained to use that particular PPE. The compensation unit will coordinate with the Finance and Administration Section Chief on briefings of accidents and injuries to date and the status of any ongoing investigations. They coordinate with the logistics section on equipment loss or damage. They will coordinate also with the logistics section on any ongoing investigations that related to that equipment loss or damage. Then you have what is known as the cost unit. The cost unit creates and maintains cumulative response cost records. They provide reports and advises on potential cost savings. The cost unit will obtain the records, will obtain and records all cost data. They will make recommendations to the incident manager and the other IMS leadership on cost saving recommendations. The ideal is to slash costs, not to keep them rising. They will ensure that equipment and personnel for which payment is required are properly identified. They will work closely with the logistics section and the planning section. They will analyze and prepare cost estimates, look at what kind of cost reporting processes are in place. They will coordinate with the section chief to ensure that any recommendations are cost saving is articulated, or even to report if there's something in place that's wasting funding. So if there's something going on that shows a big waste in funding, the cost unit will coordinate with the section chief on that. They will implement established procedures to manage reimbursements. We also have what we call a time unit, and some considerations should be taken when you're thinking about bringing on a time unit. It's not something that you need to bring on all the time. One consideration is, will there be any type of extended hours that's going to be implemented during the response? Will you need to have different shifts? Will you be running a 24-hour around the clock response? So the time unit will ensure that personnel are compensated for time worked and documentation are implemented in accordance with their established procedures within that country. Some countries have procedures in place to pay overtime. So the time unit and the way it will actually be used is dependent on the country itself. One thing you need to look at is how would you, if you have to track time, how would you be recording and paying for overtime? How are you going to track, record, and holiday time? Do your country have a mechanism to pay for staff working on holidays? And then who are working those holidays? And this is where the time unit comes into play. Will the hours be extended? Will you have people working during the daytime and also have people working during the nighttime? Will you have to keep up with a specific time of your responders or your deployers going into the field, into certain areas? Is there any type of special pay they get for working at treatment units? So this is where all the considerations you need to take into play when you thinking about bringing on a time unit. So responsibilities and coordination of a time unit, they ensure daily personnel time recordings. Documents are in effect. They make recommendations and take corrective action to address any inaccuracies and any problems in the system. They will implement all the established procedures to track personnel hours. And they will also ensure the logistics section properly records equipment use time. If the logistics section is utilizing any equipment, have contracted any equipment to use, and it's based off of the time frame to use, they need to track how long they actually use the equipment. So the finance and administration section to actually pay. So this is why equipment use time is important to track also. So now we look at what happens when the response is over. What do the finance and administration section does in recovery? During the recovery phase, this section, again, they will coordinate with all the IMS sections. It's important that they reach out to all the IMS sections during the recovery activities. What they're looking for, they want to ensure that resources and donations are returned, are reallocated. Any financial accounts, incident financial accounts are finalized and closed out. Any public health treatment, prevention, or mitigation initiatives are returned to the regular processes. They look at anything that has been uncommitted funding are processed through established procedures. And we talked about the different types of funding that's available during response and the mechanisms and how do you replenish it. So at the end of a response, if there's uncommitted funding, depending on the country and their processes, this funding might be rotated back into the response funds. It could be reprogrammed to replenish some of the departments that funding was shifted from for reprogrammed funding. It can be used to put into the the pot of money for supplemental funding for in the future. So you got to look at what would you do with your uncommitted funding and the process that's in your country. This is where the finance and administrative section will start implementing that process. Doing the overall incident closeout, it's important that all budgets are closed out and that the administrative records are archived and kept for future use. Any claims that has came up, again, if somebody doing the COVID response, if out there working, if they tested positive for COVID and now they have to stay home and they cannot help with the response at this time they're at home. So now they're at home with the rest of their family. You know, the compensation claims or insurance claims that comes from within the country, depending on the processes in place. Do the country take care of the medical bills for the responder? Do they take care of the medical bills for if a family member also tests positive because the responder brought it into the household? So these are the things you have to think about. And they want to make sure that they work with the finance section to close out any contracts that may be still open. So we have been talking about the preparedness stage of this section, the response phase of this section, and the recovery stage of this section. I'm going to also talk about what it takes to actually maintain some funding things to think about when you're looking at a public health EOC, funding and sustainment of a public health EOC. A lot of you already have public health EOCs. Some of you are thinking about implementing public health EOCs, and you might have public health EOC at your national level, and you're looking at the subnational level. Just some initial cost things that you always should put in your planning is your initial cost. So the initial cost, what do it initially cost to start up an EOC? You know, your training, the training of staff, the development of putting everything in place, the equipment, the capitalization, the overall head, funding needs. Then you have your operational costs, the utilities, your services, water, electric, your janitorial services, security, staffing. Then you have to look at doing response. That's the surge. You're going to have more staff coming in. You have more electric. You have more water needs. Your janitorial service needs will increase doing any type of response. So you have to take in consideration that funding. Then your overall sustainment funding. What it takes to sustain the facility. You have the physical updates to the facility to just reinforce it or just make it better. But the everyday maintenance needs a lot of people forget about. It's so easy for things to break. If you have a step, you'll see that has stairs, you have a step that came loose. If you have a banister, it came loose. You have a door, a handle come off. In your toilets, if they start breaking, these are just everyday maintenance things that you have to put aside funding to maintain these things. Then, of course, you have the reoccurring costs of fuel for the generators. These are all things that needs to be considered. So I just wanted to make sure I go over that to just give you an idea of things to think about when you get ready to implement public health EOCs and what it takes to maintain and sustain those things. To always think about that in your budget. And again, the finance and admin as a whole can actually help out here because a lot of them already work in the financial departments within the ministry. And so they're used to putting these type of budgets together, and they can help with you in your planning. So with that, I say thank you. And that would end my presentation.
Great, thank you, Kari, for your wonderful presentation. I think we're gonna start here with a few questions, and then I'll turn it over to our other panelists to hopefully also ask some key questions that they've seen as well. So let me start here, trying to see what's our good intro question here. I think, you've talked a lot about the different functions within, finance and admin, and different considerations, both sort of during a emergency as well as during, peace times. I'm wondering if you could give a few more examples or cite from your experiences, both a couple different things. One, best practices for sort of coordination across different functions, because although obviously admin and finance is responsible for particular functions and activities, there's a lot of cross coordination that needs all of those functions work well together. But also I was wondering if you could take that a little bit further and, talk a little bit about how do you test these capacities and ensure that your finance and admin pieces of the puzzle are all working together, sufficiently so that in multiple, outbreaks or emergencies, you have what you need in place and you're not finding out during that time of emergency that you don't have what you need. Could you comment a little bit further on that?
Yes, thank you, Emily, for that question. Actually, best practices, what I've found, been doing this for years, is for the finance and administration section to work very closely with logistics, the logistics section. And the reason I say this is because the finance and administration section is going to, again, they do the cost estimates in the budget, but the logistics section is going to actually go out and purchase all of these things. So if you, as your country, can come up with procedures in your EOC during response, that these two work very close together, maybe even in the area that you have for the logistics where they sit in the EOC, to actually have a finance person sitting in the logistics section with them. Again, they should know each other in peacetime as well as in response time, and they should develop that relationship and train together. But I've seen best practice is when the finance section actually works in the same, coordinates in the same team room or area as the logistics section, that they be more successful. They do a lot with the plan section, but really the plan section is before the response and the more peacetime and to get everything in your response plans. But during the actual response is the logistics section more than anything else that the actual finance section will be coordinating with.
Great, thank you very much. So I'll ask one more question here from myself, and then I'll see which questions our other panelists may want to pose to you. We had a question about, how best practices for tracking funding and expenditures. and was wondering if you could sort of comment on that, taking that a little bit further in terms of, especially in lower resource setting where, software and systems may not always be present. What are the best ways for ensuring that everything is accounted for properly, can be closed out or opened properly, and how do you see as the best are there best practices for organizational pieces of that?
Thank you. So everyone knows that everyone wants the best software. We all want the best software when we can get it. But I think what people forget is even with the best software, there's the good old-fashioned spreadsheets that everybody forget for backup. A lot of us don't have the luxury to have that type of software, or maybe even the bandwidth to maintain that type of software on something. But you always can just fall back on the good old-fashioned just a spreadsheet. And I do believe that a good finance person is trained on both. They're trained on putting together a budget estimates and tracking budgets with on a spreadsheet, just as well as using the latest and greatest software. And I think that everybody should be looking for that. You should be training both ways because technology is only as good as technology works. And if you lose power or the technology is not there, then what are you going to use? So a good old-fashioned spreadsheet, and so the finance and administration section, I think you should train them to track those things.
Great. I think that was a great reminder, I think, just generally, and I know we've discussed this in, other sessions and other series as well, of that, we always are kind of inclined all around the world to say, what is the best software? What is the best technology that we can use? But a lot of times it comes down to remind that you don't necessarily always need the best software because, you can plan for any event not having access to technology because it's failed or for many other reasons. And it's a really great reminder, I think, about, using multiple different sources and being able to work with what you may have available to you at that time. So thank you for that really valid point. So I think I'll turn it over to Ramesh to see if you have any questions that you'd like to pose to our wonderful presenter here, and then we'll keep going with some more questions. So Ramesh, over to you.
Thank you. Kari, I think you did a very good job of laying the groundwork, maybe on a practical note about what I have seen in reality and want to see how you think we should tackle, which is in the admin and finance, which is usually a unit that is quite rigorous, quite stringent, and quite based units. Often request timely reporting and timely disbursement of funds and timely execution of encumbrances and so on and so forth in the emergency space. Knowing full well that, some of the developing countries, at least in the resource limited environment we work with, their procurement process slows down. They cannot procure as fast as they want. Consequently, they may not expend funds properly. And also some things that they want cannot be procured in those countries for various limitations, including could be sanctions or could be time delays and could be no presence of an individual sending you any stuff you would need and all that. So in the admin and finance, what would be their role insofar as facilitating this discussion? And bearing in mind that funds are hard to come by, so that we should not be returning the money back to the donors, but we should help facilitate that part. That's one. Second is, I think some of them have asked here already, but in general, do you recommend a costing tool that you would, or even an Excel based, allow proper planning of an incident management process ahead of time in scenario A, B, and C, being an acute emergency to whatever the categories that people would want to come up with, so that they have a template as to how much it would cost to operationalize something in their country context. So those are two very broad questions that I would like your reactions, please. Thank you.
So I will take the second part first. In the I would recommend actually for each country to look at having a tool in place to lay it out ahead of time of a response for requesting funding. It will make it a lot easier on you. Again, you are so correct. You know, depending on the country, things do not flow as fast, and you have these roadblocks in place that getting stuff procurement is sometimes is not it's not a quick process. Even requesting things in a lot of these countries is not a quick process. So this is why the in a preparedness stage, it's so important to put as much things, templates or processes in place as possible. If things need to be signed, maybe already having it already drawn up and looking at who and have a list of who are the ones that can sign for, you know, to authorize this, have it drawn up. And so your staff can then go to one of the people already pre-designated to who has the authority to authorize that particular action. And so these are things that whenever you can put anything in place, what we call leaning forward, so to speak. If you can lean forward, you want to lean forward as far as possible without actually falling down. So definitely put anything in place that can help you. So I would say that.
Maybe the last question I have for you is, you know, it's about auditing and audit process. Emergencies, sometimes the flow of fund is quite high, depending upon what emergency you're dealing with. And consequently, there are also flexibilities in procuring items because this is an emergency. So there are potential pitfalls and frauds that can occur during the process. And, you know, countries need to be mindful of that. Even though Public Health Emergency Operations Center, when we are teaching all these webinars and courses, we got to kind of introduce them those notions of audit. And admin and finance very much, I think, aligns with auditing processes as a cross-check to make sure nothing really fails. So what would be your recommendation in this structure that you have proposed as one of the ways to kind of think ahead of time and not to get into the problem later? What would be your advice on that? Thanks.
With that one, I don't know if I'm the right person to recommend on that particular piece, but I would say I do agree with you. To audit afterwards is something that do need to be done. I know a lot of people are afraid of the word audit, but it's a needed step because you do need to make sure that your funding was not wasted, or audit brings out a lot. And so it's a needed step. I'm just unfortunately not the one to can actually elaborate on that. Sorry.
No problem. Thank you very much. Emily, back to you.
Great, thanks, Ramesh, and I think thank you to Kari as well, providing a sort of a great overview of some of the things that need to be considered, obviously both during an active emergency and the planning and the necessary steps that go into place to ensure that throughout all stages of planning and response and recovery, that structures and systems are in place to operate efficiently and effectively. So Chimwemwe, I'll turn it over to you to see if there's any direct questions that you would like to ask that you've seen from the panelists, and then I can pull a few more from the chat box as we have seen come in over the last few minutes. So Chimwemwe, if there's any particular questions you'd like to raise, over to you.
Thank you, Emily, and thank you, Kari, for the great presentation. I actually also noticed from the comments on the chat box where attendees are really happy with the presentation, and it's very insightful. So from my side, I think just one question that I noticed in the Q&A box from one of the participants, and it's based on the finance and admin activities during the recovery process. And the question is, which mitigation initiatives are done during the recovery process, that is by the finance and admin sections?
So when we talk about mitigation initiatives, we're just talking about things that was going on in place. Let's say that there was like a vaccine campaign or something going on, and then it was long-term vaccine campaign, and the response is going into a recovery phase. But the actual vaccine campaign is going to keep going. So in that case, what I was just saying is that looking at the program within the ministry that's normally handle vaccine campaign, it will come out of the public health EOC and just go back into the ministry for full engagement. And so that's what we mean by mitigation initiatives. Will just be turned back over to their normal departments or programs.
Okay, thank you, Carrie. And over to you, Emily.
Great, thanks, Timwamwe.
I have one more question. Can I ask?
Please go ahead, and then I have another to go. So please go ahead, Ramesh.
Thank you, Carrie. In terms of interagency engagement in the admin finance part, what I mean here is that most of the events managed at the country level are not just Ministry of Health alone, because EOC is a place where many stakeholders engage. So in the admin finance, where cost sharing is involved, such as operation involves A and B and C part by sector A and sector B, in this case health would be Ministry of Health and so on. How do you recommend admin and finance unit representatives sitting in the EOC to be mindful of that piece, where information flow is not always clear, but action needs to happen on the ground, and the commander or the incident commander is going to be scratching their head otherwise what to do? So what would be your approach to solving that problem?
So that's a very good question. And it depends on the situation and what the process for that particular response going on in that EOC. Interagency involvement in the EOC is big. And I always tell everybody, you have to train together. And that's one step, is that you start out doing an interagency training. So when you're training or you have any type of exercise, or you should be inviting your other ministries, because like you said, it's more than just the Ministry of Health. When you do your risk assessments, you should be inviting the other ministries, because it's more than just the Ministry of Health, and then identifying those risks, and what risks you identify affects the other ministries too. And so I think the biggest piece is to train together. And then they come up with their what process that fits that particular country, the in line with how the government is ran. You come up with the system in place and the procedures for any cost sharing. And everybody is very familiar with that procedure and process. And I think it starts out, again, from the preparedness stage. You have to start in preparedness. The key thing about preparedness is that's how you prepare for anything that's going to happen. And if you don't come together in preparedness, in response, when you have to come together, it just does not work. So I would just say to everybody, please bring everybody to the table and make it multi-agency, make it multi-sectorial, bring them together from the beginning. And if you start from the beginning working together, when you have to come together in a response, you'll have all that already worked out.
Thanks a lot. Over to you, Emily.
Perfect, thank you. And Kari, actually, just to take that a little bit further, that was a similar question that I had. In terms of resource mobilization and for planning for needs, and obviously the admin and finance section within the Ministry of Health or within the EOC, there is a certain amount of communication and overall advocacy that needs to be done to leadership to indicate what needs there are. Of course, it's going to be determined by the country structure and the layout of the response. But I'm wondering if you could, describe a little bit more, what role the admin and finance section may play in really not just, the multi-sectoral coordination and the, that you've just previously described, but also in really communicating to, high level leadership, the needs of the EOC and the needs, in terms of planning and response. So to ensure that, that's adequately accounted for and that those needs are aware, that the leadership is aware of those needs as they may be somewhat segmented from response and emergency management activities. Any further comment on that?
Well, I would say start with whoever the admin administration section chief. You really need a good person there. They need to be knowledgeable, more than knowledgeable, they need to be an expert on the funding sources and mechanisms within that country, and how to, what donors are available. That person needs to have that knowledge more than anybody else, because they're the ones that's going to make the recommendations and be talking to the incident managers. And you got to remember, the incident managers might not have all of this knowledge. So that's why they're relying on that section chief. So that's an important role for a finance and administration section chief, is to have all of that knowledge, because then they will be going to the government, to the leadership, and help facilitating these conversations and help guiding, what can be done. They also, in the preparedness stage, to be already having these relationships with the donors. A lot of times we coordinate with donors outside of response. It could be, example, Bill and Melinda Gates. A lot of times people, they'll have something and everybody go over to, sit in a conference or something with them and coordinate some and listen to some briefings and try to coordinate some funding off on the side. These are things that needs to be done ahead of time, and that section chief, when you're looking at who's going to pull this section, it needs to be somebody who's got a financial background. It needs to be somebody who understands how the country is structured, and it needs to be somebody who knows what donors works inside the country. And I think that will help facilitate all of those discussions.
Great, thank you for that. I think a really good reminder about how important it is to continue to plan and have accounted for all types of different situations in your policies and procedures, especially during your preparedness phase, to ensure that those relationships, which are quite critical of an emergency, are in place so that you are not, developing those relationships, event. So really great points there. We're coming up on the end of our time. I think one last question that I may have for you is more of a general question. I think the admin and finance pieces, fit in a particular, skill set of individuals who may be focused more on these, admin finance pieces and have a particular background in, procurement and resource mobilization and overall management. Is there any type of, general overview that you recommend, though, for all staff? I think, to avoid kind of overly segmenting this portion of, this response function in one sector. I'm not indicating that, anyone would need to be an expert overall, but I guess, just for, public health emergency managers and others who may not be quite as involved with the admin and finance section, what do you recommend for, that staff and their knowledge base to ensure, that goes as smoothly as possible across functions?
Probably would be communication and understanding. When you're dealing with cash flow issues and administrative records, I would say a general thing for all the staff is to have a little patience. You want them to be able to be the type of person that can communicate well with others, and to also just be, I guess, a little what we call attention to detail, to make sure that they're able to capture things and know what needs to be captured. Sometimes you can hear what one section might not see as, well, this is not something we really need to keep up with. For finance administration, it goes back to the word of audit. So you find yourself keeping up with detailed records. So very detail oriented. Maybe they need to be. And again, just as they're working across with the different functions, or just somebody from other functions might want to come work with them. These are just things to keep in mind as you're working with that. I think with all the functions as a whole in the IMS, I do find best practice is to work different functions. You have said, Emily, you might not be an expert in all of them, knowledge across them. So if you get an opportunity to cross train, that's good in any EOC, because as staff get limited, and you might have a response like the COVID that's so just extended, and people are just tired and exhausted and worn out, and that you might have limited amount of staff to come in, actually work in your EOC. So it's good to be cross-trained, to give that to them. And I feel everybody, because this has been a long response, and I know working with some of my countries, they already told me that they're kind of tired. So I would say to everybody, just be patient. That's one thing about working at EOC. Be patient, and if you can, step back, take a day or two off, clear your head, and come back in.
Great. Thank you, Kari, and thank you for those lovely words of advice and encouragement that I think everyone around the world probably needs at this point in time. So I will quickly close us out, but before I do so, I wanted to make sure that if either of our panelists had anything else that they'd like to note, please feel free to do so at this time, and then otherwise I will close us out for today.
I think one point I want to emphasize what Kari just said. Cross-training is quite key. In some EOCs, there are only 3 or 4 people, and sometimes they're equally busy. And I think, it's like a jack of all kind of analogy, but you probably have to do that in the EOC context to know the entire process, in as much to step in for somebody who may be on an emergency or got sick immediately for dealing with a particular infraction, and so on and so forth. So I think it's really important to learn in as much as possible, and maybe that is the 1 month shift they have to take for each of those desks that they need to sit in and learn by either shadowing or learning what happens in that particular unit of space. So a surveillance and epidemiologist may not want to know much about admin and finance, but they probably need to know a lot more than they think they would know. So with that said, I think this was a fantastic meeting.
Great. Thank you. All right, so I think I will close us out for today. Thank you all for your presentation. Brief reminder that next week we will continue our series, the Incident Management Systems series, focused, oops, I apologize. We hope that you will join us next week for our next series. We really value your feedback, participation in the survey that you will receive about the content of the webinar and the experiences in training. We highly encourage you to submit your feedback as it helps shape the direction of these sessions and will help take us into account the interactive and valuable nature of these series and what is most important to you. We do hope that you will continue to engage on the Discord platform for continued engagement through the communities of practice. In that platform, as many of you have asked about, you will find stored materials from previous webinar sessions along with the quiz for completion at the end of this series. As also noted, the series comes with a certificate for attendees who are consistent in attendance and pass 90% of the quiz questions. We want to especially thank our speakers and our panelists for their wonderful contributions. Thank you to you all for all of the questions and the lively participation that we've had throughout the Q&A. We look forward to everyone joining us next week for the next session in the series. We hope that everyone has a great morning, afternoon, or evening, depending on where you are joining us from. And thank you. And we look forward to seeing you again next week for the continuation of the Incident Management System series. So thank you very much for joining us. Bye-bye.